Hi, I'm Garvin. Welcome to our telehealth video series. In this video, I'll give a brief overview of what you need to know about Crohn's disease. In particular, I'll cover what is Crohn's disease, how do you treat Crohn's disease, and how you can better live with Crohn's disease. So to start with, what is it? Crohn's disease is an inflammatory bowel disease. It causes inflammation of the lining of your digestive tract, which can lead to abdominal pain, severe diarrhea, and even malnutrition. It is estimated that around 15,000 people suffer with Crohn's disease in Ireland. Crohn's disease can affect any part of the gut. However, it most commonly occurs at the lower end of the small intestine, known as the ileum. So patients usually suffer from bouts of Crohn's with periods of remission between them. The inflammation caused by Crohn's disease often spreads deep into the layers of the affected bowel tissue. Like ulcerative colitis, another common irritable bowel disease, Crohn's disease, they can be both painful and debilitating, and sometimes may lead to life-threatening complications. So signs and symptoms of Crohn's disease can range from mild to severe and may develop gradually or come on suddenly without warning. You may also have a period of time when you have no signs or symptoms, which is remission. When the disease is active, signs and symptoms may include diarrhea. The inflammation that occurs in Crohn's disease causes cells in the affected areas of your intestine to secrete large amounts of water and salt. Because the colon can't completely absorb this excess fluid, you develop diarrhea. Next would be abdominal pain and cramping. Inflammation and ulceration may cause the walls of portions of your bowel to swell and eventually thicken with scar tissue. This affects the normal movement of contents through your digestive tract and may lead to pain and cramping. Next will be blood in your stool. Food moving through your digestive tract may cause inflamed tissue to bleed, or your bowel may also bleed on its own. You might notice bright red blood in the toilet bowl or darker blood mixed with your stool. Next will be ulcers. Crohn's disease can cause small sores on the surface of the intestine that eventually become large ulcers that penetrate deep into and sometimes through the intestinal wall. You may also have ulcers in your mouth similar to canker sores. Reduced appetite is next. And weight loss. Abdominal pain and cramping and inflammatory reaction in the wall of your bowel can affect both your appetite and your ability to digest and absorb food. People with severe Crohn's disease may also experience fever, fatigue, arthritis, eye inflammation, and skin disorders. Delayed growth or sexual development in children is another one. So a number of tests can be carried out to diagnose Crohn's disease, and which ones are used will depend on the part of your gut that is affected. Tests that can be used include stool tests, blood tests to check for anemia and other deficiencies, biopsy, where a small sample of the lining of the gut is taken for analysis under a microscope. You can have a sigmoidoscopy. It's an investigation of the lower bowel using a sigmoidoscope, which is a short, flexible telescope, and also a colonoscopy investigation of the colon using a colonoscope, a long, flexible telescope. So next is how do you treat Crohn's disease? Medicines or steroids are used to reduce inflammation in your gut and are commonly used to treat Crohn's disease when it first develops. So they are usually taken in oral tablet form or as an enema if the rectum or lower part of the colon is affected. So first, the steroids. If the symptoms of Crohn's disease are severe, a course of steroids, which is corticosteroids, may be recommended for a few weeks. In most cases, about 70% of cases, the symptoms improve within 4 weeks of starting steroids. As steroids can cause side effects, they're not usually used as a long-term treatment. Next is Amino Salicylate medicines. Amino Salicylate medicines can be used as an alternative to steroids to treat mild to moderate symptoms of Crohn's disease. They include cilazopyrin, pentasa, asacolon, mesivant and salofac. Next is antibiotics and immunosuppressants. Some people with Crohn's disease do not respond well to steroids or amino salicylate medicines. In such cases, a specialist may advise that you use antibiotics to combat infection. Immunosuppressive medicines such as methotrexate, antibody therapy, Remicade or Humira, or a combination of these treatments. So next will be surgery. As a last resort, if other treatments do not work, surgery may be required to remove the affected part of the gut. The affected part is removed and the two ends are sewn together. Surgery may also be required to treat complications such as obstructions, abscesses, or damage to the gut. And next is diet. If you have a particularly bad symptoms which cannot be controlled using medicine, you may be given a very strict diet to follow. In most cases, after sticking to the diet for a few weeks, the symptoms improve and a normal diet can be gradually resumed. And finally, we look at how do you live better with Crohn's disease. So there's no firm evidence that what you eat actually causes inflammatory bowel disease, but certain foods and beverages can aggravate your signs and symptoms, especially during a flare-up in your condition. If you think there are foods that make your condition worse, try keeping a food diary to keep track of what you're eating as well as how you feel. Limit dairy products. You may find that problems such as diarrhea, abdominal pain and gas improve when you limit or eliminate dairy products. Try low-fat foods that may be especially troublesome. Include butter, margarine, cream sauces and fried foods. Experiment with fibre. If raw fruits and vegetables bother you, try steaming, baking or stewing them. Avoid problem foods, so eliminate any other foods that seem to make your signs and symptoms worse. Eat small meals. You may find you feel better eating 5 or 6 small meals a day. And drink plenty of liquids. Try to drink plenty of fluids daily, and obviously water is the best. And now, before I finish, there are numerous products available at Lynch's Pharmacy in Douglas, in Cork, to assist you in managing Crohn's disease more effectively, such as probiotics, fish oils, vitamin D, psyllium husk, multivitamins, iron and anti-diarrhea medicines and rehydration salts. We will advise you on what's most appropriate to you. We also have numerous products to get you set up and started on a gentle exercise program, such as exercise balls, floor mats and weights and various other pieces of exercise equipment which are required to get you started on a program tailored to you. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new service offering we're doing, a telehealth clinic. You can book a 30-minute clinic with us and we help to increase your understanding of your illness. During a telehealth clinic, together, we create a cohesive management plan which enables you to take a more active role in managing Crohn's disease with confidence. Call into us at Lynch's Pharmacy in Douglas and Cork, or call us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.